All right, so clean the ports. So 3 ml, right? You put air in here, so this will allow me the ease of drawing up. You see how it's bubbling? Mm-hmm. So amiodarone has this property, will do that. And what you want to do is you want to be careful when you actually input it in your bag. If you mix it too vigorously, what's going to happen is you're going to have a lot of air bubbles. So don't do this the moment the medicine is in, right? So I want to expel all my air. And then we send to the ed port, right? Truly speaking, when we do this in the hospital, we have a filter because this can cause phlebitis for the patient. The next thing I do is don't do this. I'm gonna do this in order to gently mix it. This goes in the sharps, right? And then ideally what you want to do is you want to have a label where you write for your medications, whatever it is, right? So we put amio. Is it recording now?
I turned it off.
So you're going to put 150 milligrams in 100 ml. And then the label goes in the back of your med, right? This basically tells you this is not just dextrose. The next thing I'm going to use is administration set, 10 cc's administration set. And we have to do some math. You guys still remember the math? Yes, no? Or that medicine, that is all forgotten?
Yes.
Okay, so we got to give it over 10 minutes.
We're back.
Okay, so we got to give it over 10 minutes. Tell me how many drops am I giving? 100 drops a minute, right? Very good. And then how many drops per second am I going to give?
That's like 1.6666.
Can I count 1.666? So what can I do?
So you can count like 10.
So how about if we do 1.666 and times that by 3?
Yeah, so like every 10 seconds, so it's 100. So divided by 6. 100 divided by 6 would be like, I don't know, like, something like that. So it's 2, almost 2 a second, which could be like
5 every 3
1
seconds.
every 10 seconds.
So what I would do is 1.66. I would times that by 3. That would be like 4.98.
Yeah,
That's about 5 drops every 3 seconds, right? Now, notice I'm not going to mainline this. So if you guys start IVXs, don't ever mainline this. You're always going to put it where? Piggyback, right? But there's one thing I got to do before I make piggyback it. So I cleaned it. What else?
Close the main, put that up
Yeah,
higher than the main.
exactly, right? So this one goes here. This one goes lower. If you have the administration set from the piggyback, it's going to have those specific connections. Everybody see that? So now I'm going to come over here. I'll show you a little trick that you want to do, right? When you're counting these drops, put your hand like this, so it's gives you a contrast for the drops. And then I slowly let this out, and I want to get, we said if I did 1.66 every second times by 3, we have 5 drops every 3 seconds. So I slowly open this up. I don't flood it wide open. And then I got to see, right, that I get the correct amount. So 5 drops every 3 seconds. All right. So now I'm infusing, right, the medicine. It's going to the patient. I'm observing the patient. I'm observing the monitor. I'm observing the change in the rhythm. Rapid infusion of these drugs causes what?
Hypotension.
Hypotension, right? So now imagine this. All of a sudden, right? All of a sudden, the blood pressure is 60/40. What am I doing?
Close that line, open the saline back up, and push it up higher.
And what I do with the patient?
Lay him down.
Lay him down, right? So I open this up. This can happen in a matter of seconds, right? So I open this up and I start infusing my fluids. I lay him down and I'm going to reassess my patient, right? Usually, right, you will infuse the medication and you will see the evidence of chemical cardioversion, right? So let's just say he did not have hypotension. We gave him the drug, and he went from this rhythm to normal signs. Right? So we'll do the full vitals and everything. We just take him to the hospital. Everything is fine.
You check every 5 minutes.
Check. We're gonna do vitals every 5 minutes. We're gonna make sure you still have this rhythm. That's it. That's all we're doing.
12 lead.
Right, 12 lead. Right. Why is 12 lead important?
Let's see if there's any.
Right. Imagine if I did a 12 lead and all of a sudden I got this. Right. So now what? How's my treatment changes all of a sudden?
Now you're going to cath lab.
Transmit. But what about my treatment? Excellent, right? So now, if he's still conscious and alert, right, we went through all our contraindications. We give him aspirin. How much?
324.
324. And does it look? This is right ventricular involvement.
No.
This is anterior wall MI, right? LAD. Can we, if his blood pressure is about 120, can we assist with nitrates?
Yes.
Yes, right. So besides what we gave him, the infusion, he also candidate for this. If he has also vomiting, active vomiting, he may also be candidate for Zofran, as long as his QT interval is not prolonged. What is a prolonged QT interval? For adult males, it's roughly 470 milliseconds. Anyone above 500 is prolonged QT interval, right? So, and also he has pain 10 on 0 to 10. Can we call for some fentanyl? Yeah, so we could give him some analgesia for this condition, right? So this is the treatment he will get. A very important thing you notice when I was giving this drug, right? Emil, I did not do the following. I did not draw this medicine up like this, 150, and then I went like this. Everybody follow? Because when we do testing, a lot of you guys are adamant about 150 IV bolus, right? But for this condition, we got to give it over 10 minutes. Why over 10 minutes? Because hypotension, right? Hypotension, right? So I think in terms of the drug, right, hopefully you guys understand about the drip, lidocaine, right? And then you're not finished once you terminate the rhythm, right? You still got to do the 12 lead, reassess your patient, right? And determine transport destination. So if he's having a STEMI, you're not going to take him to the closest 911. Yes?
No.
Any questions about this? Everything clear?
Yes.